Hey everyone, it's Dr. Follicle, and welcome back to the Scalp and Hair Care channel. Let's get started with today's video. Today we're going deep beneath the surface to uncover the hidden culprits behind hair loss scalp conditions. We're talking about those pesky scalp conditions that can wreak havoc on your precious hair follicles. Think of your scalp as the soil and your hair follicles as the plants. Just like a plant can't thrive in unhealthy soil, your hair won't grow if your scalp isn't happy. So, if you're struggling with hair loss, don't despair. We're going to explore the most common scalp conditions that can cause shedding and, more importantly, how to manage them effectively. Let's start with a common one, seborrheic dermatitis, the culprit behind those annoying white flakes we call dandruff. It is worth noting at this point that dandruff and seborrheic dermatitis, or sebderm as it's commonly known, are not the same thing. Dandruff is basically dry scalp skin, whereas sebderm is an overproduction of skin cells and oils that get out of control, made worse by a yeast that feeds off this sebaceous mayhem. It all boils down to an overgrowth of a yeast called Malassezia globosa, which thrives on the oily secretions, or sebum, on your scalp. This overgrowth triggers inflammation and irritation, leading to those telltale greasy yellowish flakes and that oh-so-familiar itch. Medicated shampoos containing ingredients like ketoconazole, selenium sulfide, or zinc perithione can work wonders in controlling the yeast overgrowth. Stress can exacerbate seborrheic dermatitis, so finding ways to relax and de-stress is key. A diet rich in fruits, vegetables, and healthy fats can help keep your scalp healthy and happy. Next up is scalp psoriasis, and this one's a bit more serious. We're talking about an autoimmune condition where your immune system, for some unknown reason, decides to attack your skin cells, including those on your scalp. This leads to an overproduction of skin cells, resulting in those thick red patches covered in silvery scales that are a telltale sign of psoriasis. Scalp psoriasis can be quite uncomfortable, causing itchiness, burning, and even pain. And if you scratch too much, it can lead to hair loss. Topical corticosteroids are often the first line of defense, helping to reduce inflammation and slow down skin cell growth. Take caution with any steroids, as they are often only a short-term fix and can have a rebound effect once you stop taking them. Phototherapy, or light therapy, can also be beneficial, using UV light to slow down cell growth. In more severe cases, your doctor might recommend systemic medications that work throughout your entire body to suppress the immune system's overactive response. Let's talk about fungal infections, specifically Tinea capitis, which is a real party pooper, especially for kids. This highly contagious infection is caused by fungi that just love the warm, moist environment of our scalps. It's easily spread through direct contact or by sharing hats, combs, or brushes. Tinea capitis can manifest in different ways, but one of the most common signs is round, bald patches on the scalp. The good news is that fungal infections are treatable with oral antifungal medications prescribed by your doctor. In addition to oral medications, your doctor might also recommend medicated shampoos to help control the spread of the fungus and soothe the scalp. Now let's unravel the mystery of alopecia areata, another autoimmune disorder that can cause hair loss, but this time it's patchy hair loss. In alopecia areata, your immune system mistakenly attacks your hair follicles, causing them to shrink and stop producing hair. This results in smooth, round patches of hair loss, often appearing suddenly and without any warning. Hair might regrow on its own, only to fall out again later. Corticosteroid injections are often used to suppress the immune response in the affected areas, allowing the hair follicles to recover and start producing hair again. Topical immunotherapy is another treatment option involving the application of a chemical to the affected areas to stimulate an allergic reaction. This controlled reaction can sometimes trick the immune system into leaving the hair follicles alone. Now let's talk about a more serious condition called lichen planopilaris, a type of scarring alopecia. This means that the hair loss is permanent because the hair follicles are destroyed. Lichen planopilaris is an inflammatory condition that affects the hair follicles, causing them to become inflamed and eventually replaced by scar tissue. The symptoms of lichen planopilaris can vary, but it often presents as patchy hair loss, scalp redness, scaling, and even painful sensations on the scalp. While there's no cure for lichen planopilaris, treatments focus on managing the inflammation and slowing down the progression of the condition. Corticosteroids, both topical and oral, are often used to reduce inflammation and suppress the immune response. Last but not least, let's talk about folliculitis and bacterial scalp infections. Folliculitis is exactly what it sounds like: inflammation of the hair follicles. It's often caused by bacteria, but it can also be triggered by irritation from shaving or friction from tight hairstyles. When bacteria are the culprits, you might notice small red bumps or pimples around the hair follicles. These bumps can be itchy, tender, and sometimes even painful. The good news is that bacterial folliculitis is usually treatable with antibiotics, either topical or oral, depending on the severity of the infection. Topical antiseptics can also help keep the area clean and prevent the infection from spreading. A solution called benzoyl peroxide is beneficial in such situations and can work using only a low percentage solution. This may be worth a try to get things under control. So, there you have it, a closer look at those sneaky scalp conditions that can sabotage your hair growth journey. Remember, a healthy scalp is the foundation for healthy hair. If you're struggling with persistent hair loss or any of the conditions we discussed, don't hesitate to seek professional help, or indeed ask in the comments section below. Thanks for joining me today, and don't forget to give this video a thumbs up if you found it helpful. And for more hair-raising insights, make sure to subscribe to Dr. Follicle's Hair and Scalp Care channel and hit that notification bell so you never miss an upload. As always, check in the description section of this video for links to some of the products we discussed today. Plenty of content coming soon, so be sure to stay connected. See you soon. Take care.